Yes, it is, Nate. I'm gonna be really weird to the camera just to get my wiggles out. So, are you feeling more up on the right corner?
Yeah, right. Yep.
Yeah, because we had the muscles that were weak last time. I had to reference my notes here, but we'll recheck them anyway. And that's the thing about what we're gonna do is we recheck everything each time, because you did stuff this weekend and you have a chance of doing something different, and sometimes we pick up different things.
Yeah, and then the pain that shoots down right there.
Yeah, and we need to monitor that, because if that continues, then we'll elevate things a little bit. But for right now, let's keep things simple and tune you up and get you on your way. All right, go ahead and lie on your back. All right, so let's check left side for our reference here. Bend here, hold here, hold tight. There you go. Because there is a chance that this hip, when it's not working well, can affect that side.
Okay.
So that's why we're checking these muscles each time. Hold
Okay.
tight. Straighten the leg for me. Keep that knee straight. Turn the foot here. Hold this. I'm going to push. Hold tight. Good. And you just let me know if there's pain anywhere. Hold here. I'm going to push. Hold tight. Good.
Even with the left, I can still feel it like in its spot.
Yeah. Yep. Hold here. And generally, if you create pressure by, flexing the muscles, it can create some intrathecal pressure, and it can push on things, and you'll feel that. Hold here. And straighten the leg. Knee straight. Hold this up. Knee straight. There you go. Hold tight. So that's what we had last time, right? The psoas is weak, so we're going to adjust the hip a certain way. Let all this relax here. Good. Hold this up again. Straighten the leg. Keep it straight. No cheating. Hold here. I'm going to push. Okay, good. Hold here. Knee straight. Hold tight. And that was the other one too. Hold here. And that's the big one, right?
Yep.
That's the TFL, which hooks up to the IT band, so that can create. Does the pain, does it track down the side of your leg?
More down.
More in the back.
Yeah,
So that's that classic, sciatic nerve, or
Yep.
I wouldn't call it sciatica. I would call it sciatica.
Yeah.
That side is creating some irritation.
Yeah, exactly. That's kind of what it is.
Lie on this side. So this adjustment, I'm going to bring you. I'm going to bring you here like this. I'm going to bring you up and round you through this. Through here, push you like that. I'm going to push through this bottom segment. Through here. Up through. Good. One up here, like this row. Good. Let's lie on the other side. Busy at work today?
Was it? Oh no, I actually work Tuesday through Saturday. So.
Oh, so this is your weekend.
Yep. It's my Sunday.
Nice. Good. Lie on your tummy now. Straighten out here. Lift this leg straight up for me. Hold this. I'm going to push. Good. Same thing here. Hold this tight. So glutes are nice.
Yep.
Like that. Let's clean some stuff up here. In the mid back. Let your hands come forward here like this. Bring it right here like that. Good. All right, come on up. You can stand for me.
Yeah.
How does that feel?
Good. Yeah.
Should feel a little looser.
It does. Yeah.
The pain, it's not really a huge thing for me initially, because pain is usually the last to show and first to go. So
Okay.
like, as far as symptoms go, it's a it's a factor, but the muscle testing, how you're responding, that's the important part.
Yeah.
Go ahead and line your tummy. So we'll do some traction now. This is, did we do this last time?
We did, yeah.
Okay.
Move around a little bit.
Yep, so this is intersegmental traction. This is a Cox distraction table, flexion distraction. Basically, my intentions with this is to pin down each segment and then create a flexion to open up that disc to help the nerves relax a little bit too. So one thing to note, just let me know if this creates any of that nerve pain that you're feeling,
Okay.
because then we have to modify. But if you can see here, I'm going to take my hand here, pin that down, and just flexing the hips, legs and hips around that will just open up and create some negative pressure within each disc space. So this is kind of money, man. If you tweak your low back,
Yeah.
sometimes this is all I do with people initially.
Yeah, it feels pretty good.
Yeah, you'll feel that stretch.
Yeah.
Mm-hmm. Yep.
It's like that sharp tape.
Yeah. And as long as we're seeing change, then I'm happy. If your symptoms are stagnating, then that's when we have to elevate. And I'm not shy with, if I need to get you hooked up with a PT or a rehab specialist or a trainer that I know, just to give you some tips within the gym too.
Yeah.
Because a lot of times mechanism of injury is the biggest part of a treatment plan. Because people can, they feel better, but they re-injure themselves doing what they're doing at work or in the gym. So bring you down here. Are you working out today?
No, it's good.
Okay. What's the plan for tomorrow?
Probably do some upper body, kind of trying to
Come on up.
hold up on the back a little bit.
Yeah, it's a good excuse to get a pump.
Yeah.
Oh, my low back hurts. I got to do arms.
Right, yeah.
I do it all the time.